welcome back to our USMLE Step 1 prep series. We are going to be breaking down the social media question that we posed just last week. Today we're joined by one of our amazing USMLE counselors at St. James School of Medicine, Dr. DeJuan Kinchelow.
Thanks for having me.
Definitely. How have you been?
Been great. Lots of studying going on, just waiting around for match, and hopefully everything goes well in the next month.
Right around the corner, like what, 2-3 weeks?
Yeah. Wow. Yeah, it's close.
Well, good luck.
Thank you.
Yeah. So let's go ahead and go into, I think this week's topic is on overdose.
Yes, so this week we will be discussing an accidental overdose. So we'll look into the case of a child who gets into their parents' medications, and then based on the side effects they're having, we'll discuss the overdose that way. So as always, feel free to reach out to any of the USMLE counselors. So we have Dr. Aksa Chowdhury, whose email would be achowdhury@mail.sjsm.org. Dr. Russell Heckburn, whose email is rheckburn@mail.sjsm.org, and myself, DeJuan Kinchelow. And my email would be dkinchelow@mail.sjsm.org. If you are not in contact with either of us, or you have no preference of who gets back to you, you can email our general email at usmle@mail.sjsm.org. So without any further ado, let's hop into this week's case. So the question that was posed on social media states, a 7-year-old boy presents to the emergency department accompanied by his mother 30 minutes after developing symptoms of dry mouth, flushed skin, and vision changes. The patient was at home and playing in the kitchen while his mother was cooking. He was fine when he suddenly complained of feeling very hot and not being able to see well. His mother found a bottle of her medications open near the kitchen counter. However, she doesn't remember the medication name. Ingestion of which of the following medications is the most probable cause of this patient's clinical presentation? A. Donepezil. B. Hydrochlorothiazide. C. Amitriptyline. D. Prazosin. Or E. Rivastigmine. So some of the key features to think about is, so the patient took some medication. We don't know what it is. The mother is probably panicking a little bit because her kid isn't looking too good. But with these questions, one of the most important parts is going to be the presenting symptoms. So we have a boy who's got dry mouth, flushed skin, and vision changes. So that is the major hint as to what kind of is going on here. So we can dive into the specific drugs just because I know some people aren't as familiar, or also just potentially to give a clue as to which of the following it could be. So Donepezil is an acetylcholinesterase inhibitor, classically used for Alzheimer's disease. Hydrochlorothiazide is a thiazide diuretic, usually used for hypertension or high blood pressure. Amitriptyline is a tricyclic antidepressant used for depression. Prazosin is an alpha-1 antagonist used for nightmares and PTSD. And rivastigmine is also, like Donepezil, an acetylcholinesterase inhibitor for Alzheimer's. So knowing now all of the classes potentially could change some people's answers. So let's look at the answer. And it is amitriptyline. So why amitriptyline versus the other things in this question? For amitriptyline, it is in the class tricyclic antidepressant, so TCA. It's going to have the main effect of selectively inhibiting the reuptake of serotonin and norepinephrine. However, it does have anticholinergic side effects, so anti-parasympathetic. So classically, this is going to affect either overdose patients or elderly patients. So the side effects you get is mydriasis or dilated pupil, dry mouth, hyperthermia, so the patient feeling hot, muscle twitching can be seen, and decreased GI peristalsis. So basically your gut is going to move less. So basically parasympathetic rest and digest is activated by your cholinergic. If you block the cholinergic, you block your parasympathetic, and you basically are going to only activate your fight or flight. So basically any secretions we make, such as our saliva, our the snot in our nose, our tears, all of those are going to be down. So they're going to be very dry patients. They're going to feel hot. So things like that. So that was kind of what this child had. That was the clue to some sort of anticholinergic. And then we had to pick which of those drugs had anticholinergic properties. The other thing you can see in TCA overdose, you can see cardiotoxicity, so prolongation of the QT or QRS complex on EKG and respiratory depression. Classically, we would give these patients sodium bicarb to stabilize the cardiac membrane as well as to alkalinize the urine. As far as the other ones, let's look at what kind of side effects the child would have presented if he had overdosed on any of those. So both donepezil and rivastigmine are anticholinesterase inhibitors, like I stated, for Alzheimer's. And the adverse effects you would expect with that would be nausea, diarrhea, bradycardia, or a slow heart rate due to AV nodal block. So anticholinesterase inhibitor is going to actually increase parasympathetic, so you would expect these patients to be the opposite of what our patient has. So they're going to have much more fluids, much more GI movement, and their heart rate will actually slow down. So think opposite of these patients. They're going to be wet. They're going to be drooling, snotty, tears running, that kind of thing, as well as a slower heart rate. Hydrochlorothiazide, the diuretic, usually you would expect to see signs and symptoms of increased glucose, increased lipids, hyperuricemia, which can lead to gout, hypercalcemia, which can cause kidney stones or bone pain, and a low potassium as well. So those would be kind of things you would look out for that one. And prazosin, the alpha-1 antagonist used for nightmares and PTSD, you would expect to see side effects like headache, dizziness, or orthostatic hypotension. So going from a sitting position to a standing position, the blood pressure drops when it normally should increase, and patients can pass out. So classically in dehydrated or elderly patients, you would expect to see this as more of the side effect. So just final note, any sort of overdose questions, always pay very close attention to what the presenting symptoms are, and that usually is the biggest clue as to what medication they specifically overdosed on.
Yeah, definitely dissect the question, find out those symptoms, because I feel like what I've noticed is for a lot of these USMLE questions, there is the possibility of more than one answer could be correct. It's just which one is the best choice for this specific case.
Absolutely, yeah. They classically will put two answer choices that could be probable, but usually even the way they word the question is always most likely, most probable. So
Exactly,
one
yeah.
is more right than the other one.
Okay, great. All right, thank you so much for breaking down this question. I hope you guys got a better understanding of how to approach questions like these. Again, if you guys need any help on USMLE specifically, please reach out to our counselors. They are one of our best resources, along with these videos that we put together for you guys. If you do enjoy these videos, give us a big thumbs up and comment down below what else you guys want to see from us. Other than that, we will see you guys next week.
See you next time.